I've been working on fibroblasts for about 25 years. Fibroblasts are part of nearly all organs of the body and make up the underlying cells of the skin. It's the most abundant cell type we have, and it serves as supporting cells both physically and as a source of factors that maintain tissue integrity. I initially identified its role in tumor initiation and progression, more recently on its role in therapy resistance for cancer patients. I've since studied the role of fibroblasts in inflammation, the root cause of many diseases, including diabetes, wound healing, multiple sclerosis, rheumatoid arthritis, lupus, and of course cancer. When you delve down into the reason why these long skinny cells, these fibroblasts, can have such broad effects, you find they inherently express a number of factors that can in fact suppress inflammation. Another interesting facet of fibroblasts is that they are quite plastic, meaning they take on features of many cell types. This is reminiscent, of course, to stem cells. As evidence, induced pluripotent stem cells, or iPSCs as they're called, were the result of specific modifications to fibroblasts. Stem cells have received a lot of attention, especially in the field of organ regeneration and cell therapy. Unfortunately, there are some technical challenges to stem cell therapy that are yet to be overcome, the biggest of which is reproducible expansion. What this means is they are hard to grow in large quantities required for therapeutic applications in patients. Brute force methods that have been used can be expensive. Another stem cell type that is a bit more amenable to expansion or slightly more differentiated version are called mesenchymal stem cells. These are nice since they too have anti-inflammatory properties. However, these are unfortunately difficult to source and are thus expensive to expand due to all the additives that you have to give to these cells to propagate them. I've been involved in mesenchymal stem cell based clinical trial, in fact, and unfortunately we weren't able to move forward after a phase 1 trial in that study. In contrast, fibroblasts are the most abundant cell type in your body, as I previously said, so pretty easy to source. FibroBiologics, as far as I know, uses skin as its source. Since fibroblasts are easy to grow, scaling up is not difficult. And now fibroblasts don't have all the features of stem cells, but it does seem to maintain the anti-inflammatory aspect. The main limitation of unmodified fibroblasts is research is still exploring the many cell types it can become. Mead has been working hard since he started at FibroBiologics in the treatment formulations. I'm sure he will expand on this, but from what I have learned, he's considering giving the fibroblasts to patients not as individual cells, but rather in spheroids. This is pretty neat since it takes advantage of the natural state of fibroblasts needing each other to survive. This has resulted in not just better growth, but longer half-life of these cells. And this, of course, is important because it allows the effects of these spheroid fibroblasts to last longer in the patient and the secreted factors to hang around a lot longer to provide the desired effects. Because of the broad applications of the many features of fibroblasts, there are many aspects that are yet untapped in the realm of cell therapy. Lupus and cancer are just a few lines of research I'm aware of outside of their current pursuits in skin wound healing. Vertebral disc repair and multiple sclerosis they have going on currently in their pipeline. You have to remember much of what has been considered thus far has been with unmodified fibroblasts, just what can be grown straight from the skin. There are so many ways to skew fibroblasts with reagents or even genetic manipulation that would essentially expand the repertoire of possible interventions and targets significantly. This can mean the fibroblast could gain traits to home automatically to the site of disease or express the needed factors that it may inherently not express. As I'm a cancer researcher, such applications in cancer would seem the most evident. But for now, thanks, Pete, for letting me speak, and back to you.